Okay. Hi, everyone. Good afternoon. Thank you for joining us for today's webinar, which is on the topic of improving mental toughness for healthcare staff. My name is Amy Tausch. I work at the Pan American Health Organization in the Mental Health and Substance Use Unit, and I am the project coordinator for a project between the Pan American Health Organization and the government of BVI that is working on building mental health and psychosocial support in disaster management and also building individual and community resilience. So this webinar today is part of a webinar series that we recently launched to build mental health and psychosocial support, not only in emergency settings, not only in natural disaster settings rather, but also in the case of the COVID pandemic, which we're experiencing right now. This webinar will last less than an hour. We'll have a short presentation followed by some questions and answers, which we'll save to the end. And then I want to let everyone know that as soon as the event ends, you will automatically receive a very brief survey just to evaluate the quality of the webinar. We would really appreciate your feedback. So just a reminder that you will receive this, so don't shut down your computers right away. So without further ado, I'll introduce our presenters for today. I'm sure you're all familiar with Dr. Virginia Rubain, Head of Mental Health Services of the BVI Health Services Authority. And also with us today, we have Dr. Sidra Kadir. Did I say your name right, Sidra, your last name?
You did.
And Sidra is a psychiatric resident at the Georgetown University Hospital in Washington, D.C. She is also working with us at Tahoe right now. Welcome, and I will put the presentation up right now.
Thank you.
Thank you, Amy.
All right, Dr. Rubain.
All right, welcome to all our attendees. I thank you for joining us today. I'm going to be brief and to the point, and I hope that you find this presentation valuable. So we're going to go to the first slide. So I kept thinking, what would I say as my opening line? And it finally came to me this morning when I recalled that work is what we do to earn a living. It is not who we are. And of course, as I started speaking, it started monsooning outside. I hope you can still hear me. So work is what we do to earn a living. It is not who we are. And when we don't have good work-life balance, it's very difficult for us to be mentally tough at work. And you're going to go to the first slide. If you can hear me over the monsoon. Are we going to the first slide?
Oh, yep. Can you see it?
No, I can't see it.
Oh, Can everyone else see the presentation that's up? No. Okay, give us just 1 second.
Are you kidding
Uh-huh.
I'm going to be mentally tough. Weird. There we go.
Oh, great. Okay.
Thank you, Amy.
Sure.
So we hear a lot about physical fitness and taking care of our physical health and exercising, eating well. But do we ever consider our mental fitness? And there's things that we can do to ensure that you're mentally well, to pursue your goals, despite any challenges that you may face. And I tell people all the time, there's no physical health without mental health. You could be the healthiest athlete in the world. If you are not mentally as fit as you are physically, there's going to be a discordance and you're not going to be operating at your optimal. Mental fitness has to be worked on every day. So you're not going to meditate in January and then meditate in December. It's something that has to be worked on daily. And as you get small and large victories as you achieve mental fitness, they have to be celebrated. For example, if you're able to break a particularly toxic pattern of behavior, that needs to be acknowledged. Next slide, Amy. Okay. So mental toughness is a measure of individual resilience and confidence that may predict success in sport, education, and the workplace. My team will tell you that I'm very big on mental toughness. I tell them all the time, you have to man up. This is what we have to do. This is the task at hand. We have to be mentally tough. We can fall apart after the fact, but once we're on mission protocol, we have to be mentally tough. And it's a skill that facilitates your pursuit of occupational and personal goals. For those of you who have gone to university, you have to have mental toughness in order to survive the long hours, the multitude of commitments that come up at the same time. Dr. Kadir is right now a resident. I'm sure she could attest to all the long hours and sometimes inappropriate requests that our attendings make of us. But mental toughness is really a personality trait. It's really a personality trait that we develop because we're not all born mentally tough. It's a trait that we develop that really determines how we're going to respond to stress, pressure, challenges, even changes. You know, some people don't like change, and that is directly linked to their minimal or lack of mental toughness. Professor Peter Clow, who is at Manchester Metropolitan University and a pioneer on research into mental toughness, further describes a mentally tough person as someone who's comfortable in their own skin, can take whatever comes along in their stride, and mostly enjoy the challenge. And so, to say that very briefly, they have ego strength. They have ego strength, and they recognize that not everything that happens externally of them is a statement about what's happening inside of them internally. All right, next slide, Amy. So it's the ability to face adversity, failure. I always love and welcome failure because when you try again, you know exactly what didn't work the first time, right? And I grew up in a household that I was told that failure was a natural part of human existence. It shouldn't be an option. My mommy told me it shouldn't be an option, but she also did normalize for us that that is part of the learning process. The other day, I had my little 4-year-old niece fixing puzzles, and she's trying to figure it out and put in the different pieces. And she would make a mistake and just fall to pieces. And I'm like, dude, it's a puzzle. It's okay. If you try a piece and it doesn't fit, then try another piece, but keep trying. All right? A person who's mentally tough does not let circumstances dictate who they are in the moment. You control your mental toughness. So, of course, I'm in the area of mental health. Sometimes we bring people to hospital who don't really want to go to hospital. It is very difficult to listen to a strange person cuss you, your mother, and your whole generation. It's terrible. But when you're mentally tough, you don't internalize those things. You understand that the person is unwell and they need services, and you're the professional. And even though the things may be hurtful and harmful, I had a client one time say to me, "Why don't you go on the roof and jump off? If you die, nobody will miss you." It doesn't get more hateful than that. But when you're mentally tough, you're able to put these things in perspective and understand it's part of the job, it's just par for the course, and not allow that to affect you. Next slide. So mental toughness means something different for each person. And there's no hard and fast rules about what determines your mental toughness. For some people, going 1 month without missing a workout is them being mentally tough. Because if you're training or you're working out or you're exercising, sometimes the mind is willing but the body is not. And sometimes the body is willing and the mind is not. So being able to meet that obligation despite not being enthusiastic about it or generating enthusiasm for it when it's not your favorite thing to do, that might be your definition of mental toughness. Going 1 week without eating processed or packaged food. For me right now, going 1 week without eating cake is turning out to be more of a challenge than I anticipated. Delivering your work ahead of schedule for 2 days in a row. Meditating every morning this week. And basically all of these little examples that we have listed here is speaking to discipline.
Your mental discipline is directly linked to your mental toughness. And the more disciplined we are mentally, the more we're able to encourage ourselves and push ourselves in spite of challenges, the more mentally tough we are. Okay, next slide. So, how do we develop mental toughness? And I teach this in my therapeutic sessions all the time. We, in 2020, in the 21st century, we have been led to believe that multitasking is the end-all be-all. And what I have found as I try to multitask is I'm a lot more forgetful than I've ever been before. I am not present in the moment, so sometimes I have no idea what has happened. For those of you who text and drive, on the rare occasion that I do it because I'm trying to really not indulge that, sometimes I look at the road and I'm like, well, how did I get here? And how did I get here without being in an accident? Because it's right in my face how not focused I was on driving. So focus on one thing at a time. Complete the one thing and move on to the next thing. This helps to develop your ability to concentrate. This helps you to be one mindfully in the moment where you're actually taking stock of your thoughts and your feelings as you're doing the task. Give each task your full attention and effort. For the nurses who are tuned in, gosh, you guys are so busy. It is so easy to make a medication error when you're not focused on what you're doing. So even though the sister might be talking to you, you might have a patient being demanding right in front of you, you have to challenge yourself to focus on one activity at a time in order to maintain and increase your competency, your efficiency, and your efficacy, right? As we said earlier, your physical health and mental health go hand in hand. And there's tons of science now that tells us that most of the hormones that control our brain is found in our gut. So, gut health is very important too. You are what you eat. But the more that you move your body, I mean, if you're on duty and you can take your break and walk around the hospital campus, get outside, get some fresh air, get a rays of the sun on your face, that will help you to go back into your setting, focus on what you're doing, and maintain your mental toughness. All right, next slide, Amy. So, self-care. And I've done a lot of workshops with our nurses at BVI MHPSS on self-care. And self-care means different things to different people. But self-care is any dedicated time or activity that you utilize to refresh, revitalize, and take care of yourself. For some people, it's going to the hair salon. For some people, it's hiking. For some people, it's getting massages. But what I want you to take away from this is that self-care has to be regularly scheduled, and regularly adhered to. And when we get busy, when we get really, really busy, the first thing that we think to cut out is the self-care, because we think to ourselves, oh, well, I could do this another time. I could go to the spa another time. I can get my hair done another time. I could take this hike or this tour at another time. But when you get into the habit of postponing self-care, eventually you're not engaging in it at all. The lack of self-care is the biggest threat to mental toughness. If you're not taking care of yourself and you're coming to work with the intent of taking care of others, you cannot give what you don't have. You just can't. And as the flight attendants always tell us, put on your mask first before assisting others with theirs. So if you're going to go to the hospital and lovingly care for your patients, you should be taking time out and lovingly caring for yourself as well. Next slide. All right. So as I said, you can spend your free time doing something that you enjoy. I just discovered that really underneath my Dr. Rubin experience is a farmer brown just waiting to burst out. So I've been gardening a lot since the new normal of COVID. I don't even like saying COVID. The new normal of COVID, that has been one of the benefits that has come out of this most horrific, weird, bizarre period of time. So I've been gardening a lot. I wasn't able to read after the storm, after the Maria. Reading became very difficult for me. I couldn't focus my attention to read. And since this new disaster has befallen us, I guess it undid what the storms did, and so now I'm able to read. I'm reading comics, but it hasn't words, so as far as I'm concerned, that's still reading. Free your mind and just enjoy the moment. I am right now talking to you, and you might see my eyes going over the laptop because I'm looking at the most beautiful vista of Long Bay Beach in West End. And I spend a lot of time just sitting down and looking at the random beauty of God, and that is very therapeutic. So if needed, you could take small breaks at work to relax and compose yourself. A lot of us eat at our desk. I don't recommend that at all. We live in paradise. I'm not saying that you have to buy your lunch every day, but you can certainly take your lunch bag onto the lanai, have a seat, have the fresh air blowing up your nose. I find that when I eat at my desk, somebody always has something to tell me. The phone is always ringing. And before you know it, I've eaten my food. I have no idea what I ate. I didn't enjoy the experience of eating because I was working while I was eating. So taking breaks at work is a wonderful thing to do. Leave your ward, leave your desk, leave your office, walk around, get some fresh air, see the happenings, go into the gift shop. I go into the gift shop and fantasize about things I would buy if I was still off water. Do something to break the monotony. Be able to identify when you need a timeout. And in order to be able to identify what is going on with you, you have to be focused on yourself. You have to be focused on the physiological and the psychological clues that the body gives us that, you know what, we just need a break. Sometimes when I'm tripping over my words or I can't remember as well as I know that I can, that's when I know I need to take a break. When I find my attention drifting from the task at hand, that's when I know I have to take a break. So knowing when you need a timeout is very important. Usually we will go beyond when we need the timeout and have some type of incident and then be told that we need the timeout. But if we can identify those periods of time where we need to refresh, then we increase our mental toughness, we increase our capacity to respond to any challenges that may present in a workplace, and we go home a lot happier for it, yeah? All right, next slide. Okay, so there's two concepts I want you to leave with today, awareness and acceptance. And I just kind of mentioned it, really being in tune with what is happening with you. And awareness is being able to focus on one's feelings and experiences at the present time. Now, to take it even a step further, to be able to understand or identify the thoughts that created the feelings in the first place. So you're talking about slowing that life down to the point where you can hear your own thoughts, connect, match, pair the corresponding feelings, analyze them, and then act accordingly. So if you don't understand that your originating thought was, I hate it here. I saw a client write that today. I hate it here. What's the corresponding feeling with that? Is it frustration? Is it anger? Is it sadness, depression? Is it anxiety? And then how does that influence your behavior going forward, right? So that's the one aspect. And then there's acceptance, which is being able to observe and accept, because very often, especially when we're experiencing negative feelings and thoughts, we tell ourselves we shouldn't be feeling that way. Oh, I shouldn't be thinking these things and I shouldn't be feeling that way. With acceptance, you accept the thought. Now, you may challenge the thought because it might be erroneous, it might be distorted, it might be cognitively dissonant, but it's your thought. And you definitely accept the feeling that goes with the thought because they go hand in hand. So when you can accept your thoughts and feelings without judgment, without adding that additional pressure onto yourself, you'll be doing yourself a great service in developing mental toughness because you give yourself the right to be you in the moment. And I hope that makes sense because I can't see my attendee. Accept how you are feeling and be at peace. Okay, and the Bible tells us peace surpasses all understanding. Being at peace in the middle of a storm is the very definition of mental toughness. Yeah? Next slide. Okay, so we just have a little graphic here of some of the things that you can be mindful of when you're doing it. So being mindful in exercise. I tell this joke in session all the time. When I was a graduate student, I arrogantly thought that I didn't need to write down anything. I could remember everything my professors would say. And so the morning of class, I would get in the shower and try to recall everything. Like, was something due? Did we have a reading? If I was trying to remember what the reading was the morning of, the battle was lost. But anyways, this is my delusion. I'm going to remember everything and it's going to be wonderful and good. So I would get in the shower and try to recall what the previous class was about. And 20 minutes later, I come out of my meditation and class and can't remember if I actually showered. So now I could either shower again, get out, not properly showered, or run the risk of being late for class. And of course, I would end up late for class because I would have to actually shower just to be sure that I did. And, I laugh about it all the time because when I learned mindfulness, courtesy of Marsha Linehan, God bless her soul with her DBT skills, when I finally mastered mindfulness, it just improved the quality of my life all around. So now when I'm eating, when I'm bathing, I just bathe. When I'm exercising, I'm completely focused on my heart rate, how many calories I'm burning. When I'm gardening, I'm talking to the plants. And so my mind isn't adrift. And then I come to and I'm like, oh, what just happened? So there's so many activities that we can do when we're cooking, enjoying the smells of the herbs and the spices, enjoying the creativity of cooking because cooking is all about creation. So whatever you're doing, just be mindful of that and try to block out everything else. All right, next slide. All right, so another thing you can do to develop mental toughness, don't be afraid to say no. I'm well known in the organization for that. I defend my boundaries aggressively and viciously because I understand that if I don't, I won't be able to perform at my optimal. And as long as people think they can try, they will make requests, whether appropriate or inappropriate. But it's up to you to set limits and stick with them, okay? And this is where evidence-based practices come in, because in a work environment, very often people ask you to do things that are outside the scope of your work, that you may not have the expertise for. That may not even be your responsibility because the person who's supposed to be doing it is sitting next to you doing nothing. You have to be in a place where you can articulate effectively what your boundary is, why it is a boundary, and why you will be defending it to the death. Yeah? Positive mindset is so important. Trust me. I used to be a very negative, good-do thinker. You may not believe that, but it's true. And I find now, because I actively pursue a positive mindset, I really rid myself of all negative, well, not all, but most negative self-limiting beliefs. I'm still challenged by cellulite, but I'm working on it. Yeah, I'm going to get rid of my thoughts about cellulite just now. So when you have a positive mindset, like one of the things that I've said to myself, because my office is being renovated now, it's not the most convenient thing. I'm sitting on my floor doing this webinar. I could be sitting at my desk, but it is what it is. But I'm sitting looking at $1 million view. I am doing what I enjoy doing, which is talking. and I'm imparting information to others. So there's always an upside to anything that we perceive to be negative. The onus and the task is for us to find it, okay? So once you replace your negative thoughts with positive thoughts and positive daily affirmations, every day I get up and I thank God for waking me up. Because that's not a given. Some people didn't wake up today, you know? And so when I open my eyes and I realize I've seen another day, I am very grateful for that. And so I find myself on a daily basis affirming all that I'm grateful for. Next slide. Okay, and this is a tough one here in the BVI because people resist these two activities for mental toughness. I don't know if it's because of our national diagnosis of paranoia, but you have to have a social support network. You have to. You don't live on an island by yourself, and as much as you want to, you don't. And having good people in your life that you trust, that you could talk to when you're feeling overwhelmed, that you could talk to when you're frustrated, when you're angry, but not just when you're not feeling positive, but when you've had a victory and you can call out and say, girl, let me tell you what happened to me today. Having that social support network is so important. It lets you know that you're not alone. You're not in this struggle, this life alone. The other night when we had our earthquake, I was sleeping, and the sleep was delicious, I'll be honest. And every day I look out to see, possibly that Godzilla has risen from the ocean, and he's out there fighting with Mothra. So when I heard all the rumbling, I was like, this is it. They're here. But I was too tired to get up and look. So I messaged my girlfriend and I said, can you look out in the sea and see Godzilla and Mothra out there fighting? Because we just had an earthquake and it could be that, But I'll just say, the earthquake made me very nervous. And so I used humor to cope with it. But I had my best friend who I could share the humor and the anxiety because she understood that the earthquake frightened me, yeah? So having that social support network is so important. People here, especially my clients, will say, well, I really don't trust people. What if I make friends with somebody or make them a part of my network and it doesn't work out? So what? Just move on. Find somebody else. There's 30,000 people here. I mean, that's not a lot of people, but that's more than enough for you to find at least 3 people. The Bible tells us that we have to have a cloud of witnesses. So you can find at least 3 people that you can share time with, share activities with. We're all staycationing now. You could go hiking with these friends. You could talk about what's happening at work, whatever it is, but you need a social support network. And, of course, last but certainly not least, seek professional help when you need it. This is so important. I tell my team all the time, when in doubt, please consult, okay? We don't know everything. We can't always engage in self-healing. Sometimes we're going to need somebody else to assist us. At BVI MHPSS, we have our EAP program. You can speak to your supervisor, our referral can be made. And if you don't want to go through EAP, you can come to us on your own, and there's a multitude of private practitioners that you can utilize in the community. Going to therapy or seeking help doesn't mean that you're weak. If you're diabetic, you're going to go to an internist. Does that mean that you're weak? Well, if you're depressed, you go to a psychiatrist or a psychologist. It's the same concept. It's just so important to know that help is available and you can utilize it. All right, next slide, Amy. All right, so we have one last infographic here about mental toughness. I love the brain in the middle pumping iron. For those of you that don't know, the mascot for mental health is Dwayne the Brain. I'm the only one that loves him. My staff hates him. So when I saw it, I was like, oh, this is Dwayne pumping iron. But anyway, that's just an aside. So if you look at the infographic, interpersonal confidence, I can influence others as much as they do me. Isn't that a wonderful, positive affirmation? inabilities. I believe I have the ability to do it or can acquire the ability. And so all of these statements are positive affirmations that assist you in improving your mental wellness, or your toughness and your wellness. I can manage my emotions and others' emotions. I really believe I can do it. Goal setting, I promise to do it. I like working on my goals. I'll do what it takes to keep my promises and hit my goals. So those are just some of the examples of positive affirmations that you can give yourself. And let me tell you, sometimes you're going to hit upon negative Nellies in your support network. Be like, are you sure? You sure you can do that? You sure you're not engaging in some magical thinking? Yeah, I'm riding my unicorn right now with the rainbow sailing behind of me. But can you just support me for 5 minutes? Eventually I'll come to reality, but I'm positively affirming myself that I can fly on this horse, this white horse that I stuck a horn on. Just back me up on that for a while. So the positive affirmations are so important. All right, Amy, next slide. Okay, so now I'm going to turn it over to Dr. Kadir, and thank you for listening to these.
Thank you, Dr. Rubin. Can you hear me?
Yes, I can hear you very well.
Wonderful. That was very helpful, very practical. Thank you so much for all of those tools and skills. We are definitely going to use them. So I'm going to talk a little bit about where we are right now in the world, and there is a lot going on around us. I'm going to take a quick minute because I know we want to leave some time at the end for questions and just interactive session. So COVID-19 hit us from like nobody was prepared for it. There's no ways or means to predict something of this magnitude and impact. And a lot of us, most of us, and probably all of us were taken by surprise. We still are a little shaken and jarred by how huge this experience is for us. So we're going to take a minute just to acknowledge that, because all the people who are working in the health provision fields, in mental health, in nurses, tech staff, we are all working in a circumstance which we never got ready for. So this is uncharted territory for all of us, and it definitely is going to have mental health impact currently and in future, and we're going to study it and know more about it. But as of right now, there are a couple of things that we can do to make it easier for ourselves. The first thing that we can potentially do is to acknowledge that this is real, the risk to mental health, that this is an experience which our mind and body was not prepared for, and it is going to have an impact on us, and it is having an impact on us. Just acknowledging that gives us some room to work with. If we are going to come to work just the way we were coming to work last year or the year before, and expect ourselves to perform just the same, that is a lot of pressure that we are putting on ourselves without acknowledging that the world around us has changed. All of us, we have seen people dying. We have in our families, in our friends, and in the media news, this is an emotionally charged situation that we are working in, and we are all being impacted by it. So just acknowledging that and how it can lead to depression, anxiety, people who were already suffering, this can definitely exacerbate those symptoms. And this is a traumatic event. I'm sure in the times to come, we are going to study the effects of trauma on people who saw the suffering on others, because we are all gentle souls. And when we see that suffering, it causes trauma to us indirectly as well. So just acknowledging that this is a very difficult space that we are working in, and we bring so much to our workspace from our existence, like our experience, our seeing of death, our working with people who are suffering. So this is a huge experience for all of us, and I think acknowledgement of that is very important. Every day that you show up to work, just knowing that this is a different space that we are in right now, that helps us get prepared to deal with it better. And the other thing is that not everybody is going to be impacted the same, and we as human race are extremely resilient. And the studies in the past have shown that fostering resilience and increased resilience is actually the most common outcome of disasters, which is an amazingly beautiful thing to see, that we as humans, when we experience something like this, we actually do come out of it stronger. And that also is given a side note that not everybody. There are going to be people who are vulnerable, and there are going to be people who are going to come out of it stronger. So just acknowledging that we are all existing on this range of experience. Like it does not feel the same to all of us. It is not an equal experience for all of us. And fostering resilience is important in a way that it is not how you feel every day. It is a motivation and a decision that you're going to continue moving forward. You're going to continue to grow. Even if you don't feel your best today, you're going to come to work and you're going to try, and you're going to try your best. And the next day is going to be better. And the day after is going to be better. So all of us who feel the trauma or this very emotionally charged experience differently, not everybody is going to come out of it stronger, but not everybody is also going to come out of it impacted negatively. And even the people who are resilient, they have difficult days and weeks and months, and then things get better. And the perspective of this experience is very important. Like how I feel today is not how I'm going to feel tomorrow. And if I don't feel my best today, that is okay too. I'm going to continue to try my best and see the outcome. And then tomorrow is going to be another day. And of course, using all the skills that we talked about in a weak moment, in a difficult time, it makes a huge amount of difference, as well as acknowledging the fact that all of us struggle. All of us have difficult days. All of us have difficult weeks. And not every day is the same. And then this is a time to really cultivate and foster resilience. So I think it's very appropriate in the moment that this discussion is taking place. And fostering resilience, I think we can go to the next slide, because that's where we're going to talk about how do we foster resilience. Like the hallmark of it is that, one, you don't give up. And two, you know that there are going to be days that are going to be harder. And three, knowing that we are all in this together. And the social sort of support system that we were talking about, this is really it's like a social resource. Like we have money in the bank. You have social support system that's exactly like the money in the bank that you can draw on, that you can get benefit from when you need it. So just developing that and cultivating that around you is going to go a very long way. Like doing a small thing for the neighbors, like pro-social behaviors, they go a long way in cultivating resilience, like doing a small little thing for the neighbor, just saying thank you to somebody, just being aware that we are a social group of people who's going through this difficult time, and being kind to other people, as well as being kind to yourself. Just talking to yourself, telling yourself that, hey, you're having a bad day today. I'm here for you. Other people are here with me in this, and we're all in this together. This positive, supportive self-talk is basically giving you a message, because there is a negative thought in your head. There's a negative talk in the head, and there's a negative environment around you because it's so emotionally difficult. So just distancing yourself from that and creating a space in which you can have a talk with yourself that, hey, you are doing okay. You're coming to work. You're helping people. You're bringing so much to the work. What you do make a difference in people's lives. It is significant. They trust you and they rely on you for this. So these are the things which we don't hear too much around us, and nobody really thinks about constantly affirming this. So you have to be that person for yourself in this time and reach out to other people, because they are struggling just like we all are, because we are all in this together. And then adaptive meaning, the last thing that we're going to talk about, and we can open the house after that, like how do I change? Because the world around me has changed. Like, how do I change to accommodate myself in a way in which I'm comfortable? Like, we do daily things like day to day. We come into work, we're taking a shower, we're having our breakfast, we're just showing up to work and then going back, doing the daily rituals, but then in a different setting. And just knowing that what I do is meaningful. There is significance attached to my work. What I do makes difference in other people's lives. And if I don't do that, somebody is going to suffer or somebody is going to be negatively impacted by it. Even if somebody does not say a thank you to you, it is important to know that your work is meaningful. And that is what generates a positive cycle and helps you come to work the next day with a more positive, meaningful, and impactful approach towards your work. If it is going to turn into a task or just like a ritual that you just have to go through, it becomes more difficult to do. And we tend to forget that. You are a nurse. You are so meaningful in the work that you're doing. People are dependent on you for your life. That is such a huge contribution that you are making. And we just tend to forget that because that's just work for us. So keeping all of it in the context of how impactful it is, and given the fact that you are also struggling, so that makes it even more meaningful. And it elevates it even further, that you're working in a difficult environment, in a difficult time, in such a meaningful way. And we are all in this together, and we're here to support each other. And reaching out to people for support and also to support, that is also protective and that also promotes resilience. I think we have a little bit of a video at the end, right? Maybe we can try playing that. Is it letting you play it?
No, it's not letting me play the video. But
okay.
That's okay. We can just highlight the
right. So I think a lot of it is actually what Dr. Rubin has very beautifully sort of laid out for us already. Taking care of your diet, health, sleep, exercise, friendships, relationships, and relationship with yourself. So all of this we've already talked about, but I think it is important at this point in time to introspect, to see where you are, and to realize that this is a difficult time, and creating that social environment in which we can support each other in this difficult time.
Great.
And yeah, the slideshow in front of you right now is like the resources that you can quickly take a look at. The small videos with very brief and significant sort of doses of information that you can just check out. And I think we can open it for the questions. Amy?
Sure. Yeah. Just thanks, Dr. Kadir. Thank you, Dr. Rubain. As Dr. Kadir was saying, we have a lot of resources at PAHO WHO, and finding a source for kind of credible and helpful information is so important to our mental health during the pandemic. So we do have a link on the slide to our mental health and COVID-19 website, which has some guides, some handouts, and fact sheets specifically designed for healthcare workers, as well as the video. So now we're going to open it up for discussion. We have a couple questions on the screen that might trigger some discussion, but feel free, any comments or questions for the presenter. I also want to say we have Dr. June Samler with us, and also Mrs. Perla Thomas, Director of Nursing. I'm going to make her, I don't want to put anyone on the spot, but I'm going to make her a panelist so that she can feel free to control her mic and make any comments. And the way we'll do questions or comments is if you can raise your hand, and I will unmute your microphone for you.
While we're waiting for people to ask questions, I'd like to say a special thank you to my psychometrist, Mrs. Kimberly Parker-Fraser, who lavished me with this PowerPoint. She does all my PowerPoints, and she always knows exactly what to put in for me to say. So thank you, Kimmy.
Any questions or comments on the presentation?
There's a raised hand, Amy.
Oh, I see it. Christine, I've just unmuted you.
Hi, good afternoon. I was just going to ask, like, for some of us who are constantly more on the kind of high pressure or high stress area of work, sometimes we think that like it's so common already that we normally get through the day trying to get through with whatever stresses we have at work. How do we find out if, like, sometimes you're so used to it you don't even know that you're already on the upper threshold and you need to get a little bit of like help? Is there like a way of seeing that? I mean like getting to that, especially like if you notice it with like a coworker or something like that.
That's a good question, Dr. Harry. One of the tools that we have that we utilize when we're trying to find out when people are in the upper threshold, as you say, we use something called the patient health questionnaire. PAHO also has the gap, which has segments of it that you can do a little self-analysis. I'm not sure if you've been trained on the MGAP yet. But I think really checking in with your immediate supervisor and saying, you know what, I've been on the testing team for the past 3 weeks. I've been going out into community doing COVID tests. Maybe I'm not combing my hair as much as I normally do. Do you think that I need a timeout, or do you think I need some additional help? And this is where supervision comes in. It's so important for you to touch bases with your supervisor and for the supervisor to ask you these questions. How are you doing? How are you coping? Are you having your hour lunches every day? How have you been spending your downtime? These are things that I say to my team, especially if I notice if they're struggling. I'm going to pull them aside and say, is everything okay? I noticed you've been a bit withdrawn. I noticed you've been a bit chatty. I've just noticed. And so I give them the opportunity to self-reflect, and we can brainstorm a way forward together.
Thank you, Dr. Rubain. Yeah, that's very helpful because sometimes you notice also your coworker, but there's just between being too nosy and between being very observant. Like sometimes you really can't say with like if a coworker is like, are they stressing out or um between reporting to a supervisor and like noticing that it's like sometimes it's kind of really a challenge to like get somebody attention or get somebody help for that particular person, but you have noticed it or some people have mentioned it, but it's just that they never really they could not really act on it because like it's either the person is not really asking for help, but several of you have noticed it. So it's not really imposing on that person's right or like personal, how should I say it?
Their privacy and their right to personal autonomy. I get what you're asking, Dr. Harry, and I'll tell you this. In mental health, I encourage my staff to inform because we rely on each other to keep each other safe. So if you have a member of the team who is not functioning at their optimal, then it's their duty. They have a duty to report it to me because we might be out in the field and that person is unable to respond appropriately and it puts the rest of us in danger. My philosophy about it is it's better to overreact than underreact.
Okay.
While I'm sitting there pondering, it is the supervisor's responsibility to intervene. So I'm going to go to my supervisor and I'm going to say I have these concerns, and I'm leaving it there because it's the supervisor's responsibility to ensure that everybody has access to care and to whatever they need.
Okay, thank you.
You're welcome. Dr. Kadir, you want to add anything to that?
Right. So thank you. That was a very comprehensive answer. But I was just thinking, maybe just reaching out to the person by yourself, like, hey, I've been noticing a few things which are concerning for me. I just want to make sure that you're doing okay. Is there any way that I can help you? Is there any way that we can sort of figure it out together? Like, is there something that we can do for you? So just getting them on your side, because they are already struggling. So just getting them on your side that, hey, I know you're a great worker. I've always been so impressed, but I've been noticing that things have not been the same in the last couple of weeks or months. Is there something that I can help you with? So just instead of them versus you, just bringing them onto your side, that we are together. Let's figure this out together. That usually makes it easier to deal with that situation.
Mm-hmm.
We have a couple comments in the chat from Margaret. She doesn't have a speaker. She says her greatest challenge is getting others to understand the importance of helping others to do self-care and see about their mental health. And also mentions that her self-care is the time out and monthly pedicure with her daughter. She does personal videos and has a quarterly visit with her psychologist, as she does with a general practitioner.
Awesome. That is awesome.
Not seeing any other hands up. Any questions or comments? Got about 5 minutes left.
Amy, can we invite our nursing director to give some closing comments?
Please, yes. Mrs. Thomas, you are a panelist, so you can unmute your mic and say something. Can you hear us, Perla Thomas?
We can't hear you. She unmuted, but we can't hear her for some reason.
Okay.
Maybe she could type her comments. Maybe you could type your comments, sister, because we can't hear you. So while the sister is, oh wait, there's a question.
Yep.
See that? Okay.
Christine?
Yes, it's Sylvester Thomas at Christine Station. That's what's happening.
Oh, okay.
Actually, I'm in the room with about 8 to 10 people. We gather here and we have it projected so that more people can come in to see what's going, see the presentation. So that's what's happening. So I had to move to make sure everybody's in and everybody's engaged. So that's what I was checking on.
Okay,
that's why I'm upstairs. What happened now? I looked at the presentation. I had part of it in my office, and I saw part of it. I especially like the wheel, the last slide from Dr. Rubin, 1 or 2 slides at the end. I think it's a healthy thing to look at, to be in your office, to be in your workplace, that is it. And to see that, the challenges that you have, how you can control them, how you can get confidence, and how you can get committed. I think that I would benefit for that, and I think my entire nursing team could benefit from that on a daily basis. I'm very grateful for that. I'm sure the rest of the people with me here will be able to be, would that be beneficial to you guys? They all said yes.
Thank you, sister.
I think so. I think that's helping people to know on a daily basis to maintain your strength there. I think that's motivational.
Thank you.
In general, I think it was a healthy discussion. I think I saw engagement from my people. I think Doctor mentioned to me about 52 people are on. I think we're going to try to We need to practice and develop ourselves so that we can be strong. We are in a field where we face a lot of challenges, and mental toughness to be part of our game. I think we are grateful for the insight into that and information.
There was a question in the chat if you wanted to talk about that.
Sure. Yeah, we have a question from Natalia. How do you deal when you're overwhelmed or underperforming at work? Any tips to help focus?
Take it away, Dr. Kidder.
Okay, so the first step is acknowledging that you are overwhelmed. That is where we start, because most of the times we are just like so busy being overwhelmed that we don't even take a minute to realize that things are not the same as before. So the first thing to acknowledge, the other thing to accept, and the third thing to reach out. And there are certain indicators or markers, we can call them, like if you're not sleeping well, if your mood is not the same as it was before, if you are having a hard time coping with small things that were not bothering you before, and they're just like becoming big things for you. You're not able to enjoy spending time with people, with your family, doing small things that you would enjoy before, and you're not doing that anymore. These are all signs that it's getting a little to the point where help is needed. So, and sleep is like a big one. If you're not able to get like restful sleep and you don't wake up feeling like you're rested enough, that's usually is a good sign to tell that things are getting harder. And there are a couple of ways to incorporate sort of focus at work. If it is something which is not to the threshold of causing disruption and your sleep is fine, you are generally doing okay, but work is becoming harder, then you can task yourself with 20 minutes, like I'm going to do this for 20 minutes, and then I'm going to take a break, and then I'm going to do this for 20 minutes. And as Dr. Rubin said, one thing at a time, not forcing yourself to multitask. So breaking it down for yourself, basically, into smaller, bite-sized pieces of work and time. Like 20 minutes, I'm going to work this out, and I'm going to move on to the next thing. And I'm going to finish this task, and then I'm going to move on to the next thing. If you are doing 10 things at a time, then that's going to lead to feeling more overwhelmed, because nothing is going to get done with the way that you want it to. And the other thing, as you were talking about before, managing expectations. We in healthcare field are like, we are overachievers. We don't like doing things like which are not the best. Like we have very, very high expectations from ourselves. So in this time of stress, if you are performing at 100 and right now you're performing at like 80 or 85 or 90, that is also good enough. Just telling yourself that, hey, I wasn't 100% today. I'll try to do a better job the next day or the next week. Just acknowledging that this is a difficult time and we are not going to be able to do 100% every day of the week. That sort of takes off that pressure a little bit. And also, if there are symptoms that you're noticing, like your mood is down, you feel hopeless, things are never going to get better, I feel stuck in this situation, then as Dr. Rubin said, just like reaching out and seeking resources, because there are a lot out there and people are ready to help. It's just a matter of making that decision that, yes, I will benefit from help at this point in time.
Awesome. We have another question. Can you give some tips to master mindfulness from Giovanni? Giovanni, the most basic skill for mastering mindfulness is observing and describing. And observing is actually paying attention to what's happening in your environment and then being able to describe it in a meaningful way. And the more you practice observing and describing, the more mindful you become, the more one mindfully in the moment you become. And that's the goal, that you just laser focus on that one task. So observe and describe. And at first it's corny, you feel silly saying, I'm eating my Cheerios and they taste like dirt. And they are brown. But the more that you practice, the easier it becomes for you to observe the little crackling from the Cheerios as the milk goes over it, and the smell and the experience of eating the blandest food that God ever created. So the more that you can observe and describe, the more mindful you become and the easier it is for you to be one mindfully in the moment. I hope that helps.
Great. Thank you, Dr. Urbain. I think this might be a good place for us to stop. It's already a little after 3. So I just want to thank everyone who helped us put together this webinar and our colleagues in BVI for all their support on this project. We will, if that's okay with Dr. Urbain and Kadir, share the PowerPoint. We can also share the recording of this webinar.
Absolutely.
Wonderful. And we have some other webinars as part of this series planned for the future, so we will keep you updated. Thank you again for joining us, everyone. Have a wonderful afternoon. And don't forget to complete the survey. Thank you.
Thank you. Bye-bye.
Thank you so much. Bye-bye.